CIHackfest is really focused on new models of care, and then what kind of technologies and technology infrastructure might you need in order to deliver that new model of care.
Beautiful Stanford University at the Care Innovations Hackfest, having a great time, enjoying the sun and the people. The idea is, how do we start to attack chronic illness, living longer with disease, outside of institutions.
These are people who are super passionate about helping the caregiving community, not just purely biotech or data or mobile. It really was about conversation. It really was about teams coming together and sharing a really human experience.
Solutions that meet people and people's needs, both on the clinician side as well as the patient side. And this provides that petri dish to begin to percolate that idea into something else.
Started off on Friday, there was a reception, networking. People got to individually pitch their ideas. It was kind of a round robin. Some people pitched multiple ideas, and you just kind of look at the audience and you get a response. Some people might giggle at your ideas, some people's eyes might open.
We're pitching an app idea about improving continuity care for patients.
Reducing liability to hopefully improve patient care in the hospital.
The second day is really starting to bring those ideas into fruition, putting them down on paper, figuring out what the value add is going to be to an interested party, what the potential costs are going to be, what the potential impediments are going to be.
But my senses were, my mind was blown. I was like, this is, I was just writing as fast as I could. The mentoring that's happening here and the amount of attention that you're getting from people who are in the industry, you don't get that anywhere else.
In a way that we've not done before, the provider community has to be responsive throughout the continuum. And I think the days of these segmented and very siloed healthcare delivery models with no visibility into the post-acute world, I think those days are over.
Giving people information and giving people tools to help them understand their health through wearables, through different technology, people can get an insight into themselves and understand what makes them feel better, what is health for them.
It's really fun to have all these people come up to you and to exchange ideas and see their feedback on how we approach things. The future of healthcare is going to be high-tech solutions, but make sure they fit into the system and they work really well with all the other high-tech solutions.
There's doctors, there's business people, there's patients, there's people that need whatever we're trying to build. I find in those settings that it's more likely at the end of the weekend the teams are actually going to move forward and make this product happen.
They figured out the perfect target audience for us to start with so that we can roll out a beta, quickly figure out how it works, and then scale.
Healthcare is attracting, this is a good thing, attracting a lot of talent from a lot of different corners of the world. So it's really critical, again, number one, that passion is there and that has to come from the whole team. Number two, it has to be a solution that's simple, tangible, easy to grasp, which means in my mind it's going to be easy to adopt and it's actually going to drive some positive outcomes.
How would you envision really making this a sustainable product? I actually went back and refined my PowerPoint and really thought, hey, what are we actually doing that speaks to the caregiver, not just the end user of the Fitbit?
So Sunday is the big day, and we have a great panel of judges that we bring in to really provide that broad perspective on these solution pitches so that those teams hopefully can take their ideas and that feedback and continue to bring those solutions to market.
I think the winning team, what was most compelling about them, FitMe.Sleep, was that they've developed a solution that's going after a real problem that's measurable.
We're so new. We're a pretty young team. We just started this Friday night. So we were here to actually get a lot of learning, and we got really good enthusiastic response and help from the mentors and sponsors here.
Disruptive technologies that can be applied are very, very important and should be considered in healthcare.
We're very committed to expanding the ecosystem in which we play. So Care Innovations is all about connecting the care continuum to the home. We're out there to partner with best-in-breed providers of new smart sensor technologies and new content and new apps.
Do we need to look outside our traditional delivery system for those kinds of ideas and how to shape the care team in a way that is not only responsive to patient and consumer needs, but is responsive to payer needs and results in an overall better experience?
Ultimately, the goal is to allow people to remain wherever it is that they're most comfortable living. That's what excites me most about the future of healthcare, is that we're really embracing new models of care, and that includes new business models, new cost models, and we are innovating technologies that are going to make those models possible.